Hello, hello. Oh, look who's here. You want to say hi? Okay. No. Okay. Hey, everybody. Hello, hello. Welcome, welcome. We are here at Beyond the Surface with Sharon. We are on episode 8 here. Yes, episode 8. There we go. Okay. Beyond the Surface with Sharon. Has some volume. Okay. We are on episode 8. So welcome everybody into the room. Hello, hello. Can y'all give me a hey when you get here? Hey, hey. Give me a hey, hey, or a hello, or a what y'all doing today? It's the day after Juneteenth. Did y'all do anything yesterday? What did I do? Oh, I went to a Juneteenth celebration. I think it was in Sicklerville. It was cool. But yeah, once you guys come into the chat, come on and give me a hey once you get in here. Let me know you're here and you're watching. Thank you for watching. Thank you for your support here on Beyond the Surface with Sharon. Here, let me share. Let me share my page. But thank you all. Thank you all for coming. Thank you for being here. Oh, there we go. Oh, look, I can see myself. So cool. All right. So yes, thank you for coming on Beyond the Surface and watching where life is lifing. So today we are going to talk to the doctor is in. Like officially the doctor is in. We're talking to Dr. Hill today about pre-adolescent and adolescent anxiety and depression. It's a mouthful there. But I just thank you all for your support and for coming on. I'm here to encourage, empower, inform, and enlighten you. So today's topic, we are going to talk about adolescence and anxiety and depression, because a lot of that is going on in our society with our kids. So we're going to go talk to an official pediatrician. She's a pediatrician, and she is going to tell us all about that and give us information. So if you can do me a favor and share the page while you're watching, share the page so we can get as much parents and grandparents, aunties and uncles who can have this information in their repertoire. So we can have this information in their repertoire. So that way, we can have some tools set up for us. So that way we'll know how to maneuver and handle depression and anxiety if and when it happens in our children, our grandchildren, and even children in our lives. Even if you're like a mentor, like these are all good. This is all good information. So once you come in, oh, hey, Howa, absolutely supporting. Yes. Thank you guys for coming in. So if you're here, can you give me a hey, hey, or hi, or in the comments while you're here? I appreciate you all for tuning in. So thank you all. We just want to go over, we do have some episodes that are on. We have episodes that are on YouTube. We do have Reverend Nikki came on with episode 1. She was giving us our purpose and facing our fears. I just want to go over our episodes that we have that you guys can go and check out on my Beyond the Surface with Sharon YouTube page. We had the therapist is in episode 2 with Jen Owens. She was absolutely amazing. So go and check in. Hey, hey. Oh, you guys are checking in. Give me a hey, hey. Oh, you shared, Paula? I appreciate that. Thank you. Episode 3 was our singles, dating satisfied or a cesspool. That was a really interesting show. Number 4 was our couples. If you are a couple or if you are dating or even if you're single, that episode was really amazing. Real amazing. So if you want to go back and check that one out, that's a good one. Episode 5 was boundaries in the bedroom. Now, Katrina, hey friend, Katrina Edmonds really, really gave us some serious tools about boundaries in the bedroom. The one tool that she gave, if you kind of want to try a little something risque-ish, It's the little rubber band thing. Y'all go check that episode out. That was really informing. Episode 6 is fatherhood. It takes a village. So that was really cool. Yes, Katrina gave baby. Did she give some tools? Honey, I still would like to go wherever the place is, but we're talking about kids here on this show. Episode 7 is journaling. So journaling was a really good one. That purge journaling, amazing. So thank you, Kippy, for coming on and getting us together with journaling. I didn't even know, even if you're taking notes in your phone, that is considered journaling. So that was fun to know. So yes, thank you all for coming on. I appreciate you all for supporting my vision that God has given me. My feet are planted and my head is lifted to the sky. What we have today is a great show. I've been looking forward to this show for a while because Dr. Hill is apparently she's the pediatrician to see in the area. If you want your kid to have the best care, Dr. Hill is where it's at. She's a girl's girl, right? And she has such a beautiful spirit. I don't even want to say she's humble. She's just warm and loving, and she is so full of knowledge, and she is just an amazing person. See, look at you getting the love, Dr. Naomi. We love you. She is such an amazing person, and I'm positive and a more amazing pediatrician because, like we all say, you said, can we drop what insurance are accepted after? Because I need one. So, ma'am, yes, we can see what insurance her office takes. So that way representation matters. And I remember one of the comments that got shared, one of the posts that got shared said that Dr. Naomi, one of the kids thinks of her as Doc McStuffins. So I think that is so awesome of, representation and seeing that type of thing as kids who grow up and you see a doctor that looks like you and they can treat you. So next, we have coming to the stage, none other than, there she is. Hello.
Hey, hi, Shireen. How are you? Hi, audience. Thanks for joining in.
Yes, how you doing?
I'm doing good. It's a hot June evening. I am doing great.
It's a heat wave
ready
outside.
To go. It is. We are in the middle of a heat wave here in the Northeast in New Jersey.
Yeah, and they were just saying, like, on the news, to make sure we kind of don't leave our kids in the car, don't leave our animals in the. Every year is somebody
don't leave the kids in the car, people.
Who leave, Lord Jesus. Y'all make sure you get everybody, turn around, get your people, count. Do a head count, make sure you got everybody out the car. So Dr. Hill, I am so excited to have you on here on my platform on Beyond the Surface with Sharon. It is a pleasure and an honor to have you here. Do you want to introduce yourself and let us, the viewers, know about?
Absolutely. Hello to everybody. I'll just give you a little background about myself. I am a New Jerseyan at heart, born and raised in the state of New Jersey, actually born in Atlantic City and raised in Pleasantville. Woo. I went to Rutgers University, woo woo, for the AC.
Okay.
I went to Rutgers University in New Brunswick for my bachelor's degree. Then I headed on over across the Walt Whitman Bridge to the Children's Hospital of Philadelphia, where I actually did research for 2.5 years before I went to medical school. Did research on rotavirus vaccine development with the awesome world-renowned infectious disease expert, Dr. Paul Offit.
Awesome.
And then I went on down to DC to the Howard University.
Is that HU?
School. The HU, the Howard University. So I left the state of New Jersey to go to medical school, graduated from there in 1996, came back to New Jersey to Cooper University Hospital, where I did my pediatric residency program. Mm-hmm. And in 1999, I joined Advocare Crestville Pediatrics. Before it was Advocare, but it was Crestville Pediatrics. Dr. Cyrus Moazebi was a single practitioner in 2 offices. I joined him. We still have 2 offices, and there are now 10 of us practicing
Wow.
pediatrician. So I am in my 25th year there. The most notable thing that I did was during the pandemic, I decided that I wanted to teach. I already teach in a way as I practice medicine, but I wanted to teach on a different level. And so I got certified as a family empowerment coach
All
through the
right.
through the Certified Coaching Federation, which is out of Canada. So I did that during the pandemic. I am married. I just celebrated 18 years
Whoop, whoop.
married to my husband, Kelvin. We were one of those. We are a blended family. He had a son. I had a son. We
Hmm.
married, and together we have another son. So we have three sons. My
Awesome.
husband's son unfortunately passed away a few years ago, so we are left with two. But he did not leave us before leaving us with two beautiful grandchildren. So my bonus son gave us two grandchildren, and
Hmm.
my oldest son gave us two grandchildren. So I am a physician, a wife, a mother, a family empowerment coach, and a grandmother.
So you have a
And
lot of
sister,
hats,
friend, girlfriend, all of that, all wrapped
a
up in
lot of
one.
hats going on.
A lot of
How
hats going on.
So how do you even like how do you balance? Can we talk about that about yourself first? How do you
Mhm.
balance all of that you have going on with being a pediatrician, being a life coach, being yourself, being Naomi, then being Dr. Naomi, and then being a wife and a mom and a grandmom?
Yes, it's a lot. It's a lot. The phrase "I'm every woman" is a
Hmm.
thing, but being every woman can lead to some dysfunction in areas if you're not sure to put boundaries in place and to be
Yes.
able to balance. I wear many hats. I am a doctor. I am a wife. I'm a mom. But then I'm also still Naomi, and I have actually learned. Um, I'm in my late 50s, and I want to say it took me till 50 plus to really realize what that balance looks like. And when I choose to do things,
Yeah.
because I'm in that zone now where I'm choosing to
Hmm.
do things that make Naomi happy. And becoming a family empowerment coach is part of that hat of making Naomi happy. I was
I love
recently
that.
inducted into the South Jersey chapter of the Links Incorporated. That is something that I did that satisfies the Naomi part of me. So I'm learning balance. I'm learning that there's enough of me to go around. And for me to deprive one part of myself to give to another part is not a good balance. So just learning to take the time to experience and identify all the parts of who I am and what
Hmm.
areas are lacking, and to be able to feed and nurture that area so that myself as a balanced individual can show up as my best self no matter what hat I'm wearing.
Can I just say that when you said there's enough of me to go around, but you include yourself in that, that was
Mhm.
really like, that resonated with me to just know like it's enough of me to do all of this, but then I can also nurture and feed myself
That's
in the
right.
process.
That's right.
All
Balance
right.
and
Like, is
boundaries.
that life coaching? You're life coaching us right
Yes,
there?
I'm life coaching. I'm
Life
life
coaching
coaching.
us. Literally every woman. So we are talking today. We are talking about pre-adolescent and adolescent anxiety and depression. What's a physician got to do with it? So, what does a physician have to do with adolescence and pre-adolescent anxiety and depression?
So, what does the physician have to do with it, and specifically a pediatrician?
Yeah.
Most people who deal with anxiety and depression, you can find your psychologists, your licensed clinical social workers, people of those sorts, but
Hmm.
they have to get there. They have to get there, and normally they get there because they've gone to see their physician first, their primary care physician. And since I am a pediatrician, I am that primary care physician for my patient population. And
Yeah.
so sometimes it's a parent that will come in that has a concern about a child. Sometimes it's the child that has a concern. And then other times we pick it up when we do our screening tests, because there are some screening tests that we do in the office when children reach a certain age that kind of helps us to screen for childhood anxiety and depression when they might not even be aware that it's going on.
Okay, so can you tell us what the ages are for adolescent and pre-adolescents? Because I have like pre-adolescent at 9 through 12, and when they start to begin puberty, and then I have adolescents as 11 through 14. So am I close there with the age ranges?
You are quite close. So I like to divide my adolescent population into their sort of early, middle, and late adolescence. So
Okay.
early adolescents are what we call our tweens, our kids who are between grades maybe 5 and 7.
Okay.
And then you have your middle adolescence, where you're talking about middle school, call that middle school madness. And the parents need to understand that there is such a thing as, you know what, my child is 11 or 12. I don't know where they came from, but he and
Right.
I or she and I cannot exist in the house together at the same time. One of us has got to go.
Yeah.
Yes, that would be middle school madness, which is kind of that middle adolescence, and it kind of goes from maybe 8th grade through 10th grade. And then you have your late adolescents, who are those that are in their junior and senior year in high school, and then their freshman and sophomore years in college.
Got you. So you treat all of these age groups?
I do. I treat from birth until age 23. And you may be wondering, what is anybody 23 years old doing going to a
Right.
pediatrician? Well, if you go to Advocare Crestwood Pediatrics and I'm your pediatrician, they're
Hmm.
liable to try to keep me until they're 26 years old when they get off of their parents' insurance. But I'd say that my reason and our practice's reasoning for
Hmm.
keeping our patients through the age of 23 is that is the age that they usually graduate from college. And when I have a
Gotcha.
patient that is in my care, it takes time to nurture a relationship between the physician and the family. It's a family unit. It's not like you're an adult and it's all about you and your physician. As
Hmm.
a pediatrician, I am connected to the entire family. And so
Gotcha.
when my patients go off to college, I keep them because college in and of itself is a huge transition. So I don't want my patients to have to transition from the familiarity of me as their physician into college and then into adult medicine, because adult medicine is not the same as pediatric medicine. So we like to keep our patients until they graduate.
Because
Now,
that is like changing for them to go from an adult from high school to college and then to
mhm,
also change your doctor. That could be like a little traumatic for kids
mhm, mhm,
because
stressful. Mhm,
stressful. Yeah.
mhm,
So that
mhm.
that could potentially bring anxiety. Yes?
Yes, yes, it could.
Okay. So what can you tell us what does childhood anxiety look like? What should we be looking for?
Okay, so there are different forms of childhood anxiety. Most people think about like generalized anxiety disorder when you have a child who is just anxious and they're anxious all the time and they worry. I'm going to read. There are like 5 different forms of anxiety that I want to just take the opportunity to really get into because I think that it's important.
Yes,
So
please.
you have generalized anxiety disorder causes kids to worry almost every single day over lots of things, things that most kids wouldn't normally worry about. Well, they have homework, they have a test, they're worrying about making mistakes, they worry about friends, they worry about getting hurt, they worry about so many things that just makes them anxious about everything. That is generalized anxiety disorder.
Okay.
Some kids worry about things happening to themselves and they worry about things happening to other people.
Right.
That's a significant disorder, which is why it's called generalized anxiety disorder. Then you have separation anxiety, which
Ooh.
is what it is. Normal separation anxiety usually happens around 9 months old, when children would go to their parent, they would go to their grandparents, they would go to anybody who'd stretch their arms out and say, "Come over here, come over
Right.
here." But normally, once they get to be about 9 months old, they have stranger anxiety, and then they have anxiety about being separated from their parents. That's normal. But what is abnormal and what is troublesome is when there are children who are afraid of being separated from their parents, even to the point of when they have to go to school. Normally, when you're talking about preschool children,
Mm-hmm.
in the beginning, when you take a child to preschool, they cry at the door, and the
Right.
teacher will always say, "It's okay, mom. Just go. You can leave them. They'll be okay." And normally it's okay. That level of anxiety is normal. But when you have children who are genuinely anxious about being separated from their parent, then
Mm-hmm.
that's something to be concerned about.
Yeah,
Um,
it sounds concerning.
mhm, mhm. You have social phobias where kids and teens want to avoid friends. They want to avoid school. They want to avoid anything that causes them to have racing anxieties, for their stomach to be in knots, for them to be nauseous, for
Yeah.
I think I'm buffering here. We're not only talking about going to school, or public speaking is a form of social anxiety where
Mm-hmm.
you just get locked up and you just don't know what to do. Panic disorder. So panic disorder is a sudden anxiety attacks that cause an overwhelming physical symptoms where you're shaking, where you're jittering, where you're trembling, shortness of breath. Some of these kids actually end up in the emergency room because they're having such panic attacks and can even
Oh.
pass out from it. And then another thing that I have actually experienced in my practice is selective mutism. Selective mutism is a very real diagnosis. I've had patients who are children who will
Mm-hmm.
only talk to other children. They will not talk to their parent. They will not talk to their teacher, but have
Oh.
no problem talking to other children. And that is called selective mutism.
So that's a lot of levels or different topics of anxiety
Mhm.
that kids in general have to deal with, or even just parents even recognizing. Or so, how as a parent do you know like what to do, or when, if you see symptoms, like how
Mhm.
can you inform us with symptoms or what to look for?
Okay. So when these children, usually the parents are concerned because a lot of time the children are just anxious about anything. Some of them are
Hmm.
anxious about different foods that they eat. They won't touch certain things. They don't want to touch something because they think there's germs on it. They think that they're going to get sick if they touch something. They're constantly washing their hands, or
Yeah.
things of that nature. Then there's other ways that they come to our attention through the school district, where
Hmm.
the teacher is in constant contact with the parent. They have these parent portals now where they interact with their teachers. They used to have assignment books where the teacher would write a little note in it along with
Right.
their
Right.
homework assignments and send them homes. But sometimes they come to us through the school district. But a lot of times it's the parent at a younger age that brings to attention the anxiety disorder. Whereas when the depression comes in, sometimes it's usually picked up when we have the children do a screening assessment, a PHQ-9 screening assessment. A lot of times it's the physician that will pick up the dis, the depression, but the parent will pick up on the anxiety disorder.
So parents can bring their kid to you and say, "Hey, I think my child could have." Do you want to do a disclosure first before we
Yes. Okay, so let's before we
pause?
get into this, yes,
Pause.
let's talk about a disclosure. So yes, I am a physician. I am a pediatrician, and some of my own patients may even be listening to this live and chiming in. But I just want to say that I am not a licensed clinical social worker. I am not a psychiatrist or a psychologist. I am a pediatrician who sees children with anxiety and depression, and I'm speaking very generally about what I
Hmm.
experience in my practice. If you think that you or your child has anxiety or depression, you need to contact that person's physician. And don't say, "Well, Dr. Hill said." so
Right, because
just put
Dr.
that
Hill
just put
told.
that
Hold
little
on, let me
disclaimer out there.
rewind the video.
And
Dr. Hill said,
and
"If I
I
have anxiety, bring my kid to you." Right.
And I'm not on here to endorse any medication to treat anxiety, any medication to treat depression.
Okay. All right. So everyone has that. Our disclaimer for the show. It's informational purposes only. If you having any
Flash,
things
flash,
that you
flash.
anything that you need to go talk to your primary care physician, which is your pediatrician. Yes. Okay. Every long
Yes,
as we got that out the way.
yes,
So can I give my definition of depression and you can tell me if it's correct or close to being what your professional opinion is? I have
sure.
depression is characterized by persistent low mood, loss of interest, and enjoyment. What do you,
Yes,
am I
yes.
close?
You're close. You're close, but it has to be pervasive. It has to be. You have to see it in more than one environment. Where, let's say, so it's a loss of interest in doing things that you would normally or previously have been interested in doing.
Mm-hmm.
It's feeling down, depressed, or hopeless, feeling bad about yourself, um, sleeping too much, not sleeping
Uh,
enough, eating too much, not eating enough.
right.
Sometimes it's moving so slowly that other people have noticed it. And of course, there's always thoughts that, this world will be better off without me here. Then you really have to worry. But I think it's important to note that your child who comes home from school and sleeps every day
Mm-hmm.
may be a form of depression, or the child might just be tired. So, withdrawing from friends, normal adolescence, middle adolescence, the kids that want to come home, they want to go in their room, they want to close the door, they don't want to come out until it's time to eat dinner. They eat dinner and then they go back in. They do their homework in their room, they scroll on their phone in a room. Some of them
Mm-hmm.
have computers in their room, they're gaming in their room, and they're just away from their parents. That doesn't necessarily mean that your child is depressed. However, it
However,
does mean that they lack social cues. So you should be should be a little more interactive in your family.
yeah.
Because people just need to understand nowadays that just because a child is pulling away from doing things with the family doesn't necessarily mean that they are depressed. But there are certainly big red flags about depression and a myriad of things that can
Yeah.
cause them at different ages.
And if they see these signs, what are you suggesting that
Mhm.
parents do?
I suggest they bring them in to have a talk with a pediatrician.
Mm-hmm.
And also understanding that there is a such thing as doctor patient confidentiality. And as a parent, some of us are helicopter parents where we just
We
hover
are.
over our children and we want to control our children and we don't allow our children to have space to grow. And so now this is where we talk about boundaries in parenting. And we can't always hover and not give our kids safe boundaries, nor can you be the kind of parent who just says, you know what? I trust my child. My child is good. My child hasn't caused me any problems. So I'm a good parent because I just give them space to be. Well, let me explain to you about that giving your child space to be versus the parent who also wants to be their child's friend.
Right.
Okay? You can be friendly with your child, you can have a great relationship with your child, but there needs
Mm-hmm.
to be clearly identified boundaries between the child and a parent, because otherwise when you try to flip into that parent mode, the child is not going to understand. Oh, you was just my A spoon coon. We were girls.
Right. Right.
And now you're trying to pull this parenting role on me. And so it's not fair to the child, I'll say the adolescent, for you to now switch because you've been in a lane of, oh, you're my BFF when
Right.
you're when you should not have been. And then for the parent who is so trusting of their child that wants to give them so much space, let me tell you this.
Mm-hmm.
If you are on a mountainous road and you are driving along and there's no railing, there's no road guard to your right, you're going to hug the steering wheel 10 and 2, and you're going to
Right.
drive like this. Oh God, oh God, oh God. And you're going to be praying that you don't go over the side of the mountain because there's no boundary there. But if there's a guardrail there, you're going to drive around that mountain with a little more assurity that there's a rail and that you're not going to go over.
Yes.
Better yet, if there's a wall, a stone wall, then you might even drive with one hand. You're listening to
Right.
your music
You're
and you're
more
not
comfortable.
worried about it. Yes, you're
Hmm.
more comfortable and you're not worried about the danger of falling over the side. And so when you provide your children with boundaries, they like boundaries. They like curfews. They like for you to know what they're doing on social media when they're scrolling online. They like for you to know who their friends are because at least it shows that my parent cares, my parent
Yeah.
is concerned, and there's a level of trust and responsibility that you give to your children rather than letting them be all out, just figuring it out on their own because you think that they're a good kid and they're responsible.
Okay. We do have a question from one of our viewers.
Mm-hmm.
It says, do we call ahead so the doctor knows before we come in? Is that pertaining to like stress and anxiety? Do you call them and let them know like what you're coming in when you make the appointment?
Yes, that's good. So I have parents that some of them just drop in and they make the appointment and then they tell the kid to go stand. They either tell the kid, "Can you go in the waiting room because there's something I want to talk to the doctor about." And
While
then
you
the
guys are in the
adolescent,
back room?
no, when they're in the room
Uh-huh.
and they say, "Well, I don't want to talk in front of them." So then they'll want to have a conversation with me without their child, their adolescent, and then
Mm-hmm.
they'll want to bring the adolescent in the room. Or they'll
Right.
plop them in front of me and they'll say, "Tell Dr. Hill what's wrong." Or you know
Ah,
why we're here, which I
right.
think is very unfair. I think that adolescents need to know why they're coming to the doctor. If the parent has a concern, talk to your child. Listen, we're having a hard time with this. I want to go in and see Dr. Hill. Or sometimes I'll have a parent call in because they can call into our office and have a phone message and say, can you please leave this message for Dr. Hill? It's personal. They might not say what it is. And then I'll
Mm-hmm.
call them back. I'll have a conversation with them to kind of know what is going to happen. And I'll say, schedule an appointment because I'm not going to do the visit on the phone. But at least I know in advance where we're going with this and
Right.
then to bring them in. And on the other hand, I have had because I'm a pediatrician, I take care of my patients from birth on, and so I know what's going on with the families usually, and when
Yeah.
things are happening. Sometimes I have asked the parent, "Can you please go to the waiting room
Well,
because I
wait a
want to
minute.
talk to my patient?" Yes, I
So
have asked the
you
parent.
have asked the parents to leave the examination room and then
Yes,
you're just in there with the child.
yes, my
What
adolescent patients.
your
Hmm.
adolescent patients.
Hmm.
Okay.
Hmm.
I've never I
Hmm.
mean, I don't know as a parent how I would feel. Can we talk about that?
Yes, we can talk about that. And so normally it's a cue that I pick up on from my patient
Mm-hmm.
or a dynamic that's happening in the room, or I feel like my patient is not being open and honest because the parent is in the room. And sometimes I'll ask the parent, I'll ask my patient, would you like your mom to wait in a waiting room, or would you like them to step out? Or if they say, no, it's okay if they're in here, but then they're still closed down, and I
Right.
know that there's something wrong, especially if my screening tool for depression is abnormal, and I know that the parent might be part of the reason, or a family dynamic might be
Yeah.
part of the reason, and they don't necessarily want to talk in front of the parent. I will give my patient space to talk to me in confidence, and I will tell them, I am not going to say anything to your parent without your permission unless you tell me something is
Ah,
happening that is hurtful to you or hurtful to someone else. But you are allowed parent a patient doctor confidentiality. I've
children
also,
or adolescents and children are allowed that.
yes, 14
Okay.
and older. I will do this with my patients 14 and older. I have said to my patients in front of the parent, on your way out, I want you to pick up one of our business cards and put it in your wallet. If there is ever a time that you would like to talk to me, you are allowed to call this office and say, I would like Dr. Hill to call me back. There's something I need to talk to her about. You, 14 or older, are
Mm-hmm.
allowed to do that, and I will call you back on your cell phone number, if that's the number that you provide, and we can talk. And
I
that way
I
you
love
allow
that.
them a safe space.
I love that you give the safe space. I mean, as a teenager, I would have loved to have had the, hey, I can't talk with my mom in the room, but I can go talk to a professional and she has my best interest at heart.
Mhm. Yes.
I love that you
Yes.
offer that. So that
Mhm.
age is 14 and up is where
Yes.
if it's not like harmful to them and all of that.
Right. And so if they come in, let's say they come in and they share something with me that I feel like is hurtful for them,
Mm-hmm.
or to someone else, or if I really think that, you know what, I really think that you need to have some individual and family counseling, I will have that conversation with my patient,
Mm-hmm.
for the one whose parent is in a waiting room. And then I will say, okay, go out to the waiting room and get your parent. I'm going to bring them back in. And this is what I'm going to share with them. Or if you
Gotcha.
feel like you can share with me present, I will give you an opportunity to share. Which would you like to share, or
Mm-hmm.
would you like for me to bring it up? And whichever feels comfortable for them, I will do. And I will make the recommendation for individual and family counseling.
Because I think this is really teaching like the children and adolescents communication. It
Mhm.
teaches them boundaries. So as a parent, once the doctor says, "Hey, go wait in the waiting room," and then they're out there or we're out there and you're speaking to the patient and then we come back in the room, how should our demeanor, like what should I don't want to be like, some people be like, what were y'all in here talking about? That type of, like, how should we respond when we come back in?
Well, I have that conversation with the parent, like, I mean, with the patient beforehand, so that they know, do you want to tell them what's going on, or would you like me to share?
Hmm.
And some of it is very personal and hurtful, because it has to do with a parent, or
Right.
it has to do with a step parent, or
Hmm.
it has to do with the way the child feels like they are being treated in comparison to one of their siblings. So some of those things are very touchy. Some of
Right.
them are that my parent is verbally abusive to me, or I feel like I get punished more harshly than my sibling, or I feel like I'm attracted to someone of the same sex and I don't know how to tell my parent.
Right.
So there's different things that might come up, and depending on what happened in the room, I will tell the parent that, I have doctor patient confidentiality with your child, with your adolescent, and
Hmm.
I will not disclose what they have shared with me without their permission, unless it's harmful to them or someone else. And I may tell them what they have shared with me is not harmful to them, it's not harmful to anyone else. Right
Right.
now, they're not ready to share with you. When they're
And the
ready to
parent
share
has to
with
be
you,
okay with that.
sure. What are you going to do as a parent? What are you going to do?
You Because you cannot, what you can't do is go directly to the car and like badger the child, badger your kid, because they have a safe space, and like
Mhm.
how I said, a holistic space. You have a
Mhm.
holistic space where you can go and talk to your pediatrician, who is like your safe space, and talk about anything. So as
Mhm.
a parent, you don't want to mess that up, the relationship, because you do have these um safe relationships with your
Mhm.
patients. And as a
Mhm.
parent, we cannot go to the car and say, "Hey, so tell me what y'all talked about," and
Right.
then pressure
And
them.
right. And I'll preface it with this. Like I said, I have a very, very good rapport with my patients.
Hmm.
And I have told parents, now when you get to the car, don't try to go in on them, because I know you.
Right,
Don't
right.
try to go in on them, because I know my family's dynamics. The patients that I'm talking about, I know the family dynamics. And some of the parents, I'll have to be like, well, you need to give them some space. Don't go in on them today. They're not going to
Yeah.
want to talk about this in the car. If you push them, you are going to push them farther away, and that's not what our goal is.
And the
That's
whole
not what
point
our
of
goal
coming
is.
to you is
Mhm.
for you to treat.
Mhm.
And as parents,
Mhm.
we don't always have the tools for the treatment. We're bringing them to you for the treatment. So what we have to do is trust you as a professional to do your job. So if you're saying, hey, lay off the kids and let them give them space, then we as parents should definitely give that space.
And then,
Yeah.
like I said, if there's certainly, I refer for, like I said, individual and family
Mm-hmm.
counseling, because it's a dynamic. There's so many dynamics with families. There are so
Yeah.
many with nuclear families where it's mom, dad, biological siblings. That's one thing.
Mm-hmm.
You have blended families. You have
Right.
grandparents who are taking care of their grandchildren. You have people who are fostering.
Yeah.
A conversation with a mother with a woman who wanted to be a foster mother. Had a conversation She had a conversation with her husband, and she agreed, and she wanted to foster, special needs children. So she got a special needs child, and it was overwhelming for her. And I had a
My
conversation
Lord.
through tears with her in the office to let her know that I did not think that this was a good fit for her. I could tell that
Wow.
she was overwhelmed. She would bring the child to me, and this is after multiple visits, and it was just too much for her. And I said, it's okay if you give the
Mm-hmm.
child back. This is not good for your marriage. It is not good for you as an individual.
Wow.
And with the doctor patient relationship here with you and I need to let you know that I don't think that this is healthy for you. And
Right.
she ended up giving that child back. She
And that
ended up
was
giving that
like,
child back.
that is relationships. Cause I love that you had a relationship with her to know like this isn't something that you should be doing. It's
Mhm,
stressing, it's rearranging your whole, like your life, your
mhm,
husband, your relationship,
mhm,
all of that.
mhm, mhm.
So, how long can a parent expect treatment to last for anxiety and depression? Like, what does the treatment as a PCP look like?
Okay, so the first thing that we usually do is, if I have a child who has anxiety and depression, especially with anxiety, cognitive behavioral therapy is the number one choice,
Hmm.
and that's where we start with cognitive behavioral therapy. Can you still hear me?
Yes.
Okay. So cognitive behavioral therapy is the first thing. I do not do cognitive behavioral therapy.
Hello.
So I refer them out.
Okay.
And so they go to their licensed clinical social worker, psychologist, or therapist for that. And
Yes.
if the therapist deems the patient would benefit from medication, well, now we have to start a co-management relationship with myself and the therapist. And so
Got
I
you.
will have to have a conversation with the therapist and let them know what it is that you think is going on, that your child needs to be, the adolescent needs to be treated for. And then I will have a conversation with them. We will agree on a class of medication to begin. Usually it's called these SSRIs, which are selective serotonin reuptake inhibitors, SSRIs,
My
basic
Lord.
classes of those, right?
Okay,
So
degree.
very, very safe, a very good drug, just class of drugs to start with, but not
Hmm.
without their side effects. So I bring the patient and the parent into the office. We talk about what the options are. We talk about how I start the medication, how I titrate them up to a dose that would be effective, how often we have to be in contact. The first week, then a second week, a third week, until we get to a dose that is what I would consider a steady state. And
Hmm.
of course, I send them back to their therapist. They still have to stay in contact with them. They still have to receive their therapy. And then when they need their prescriptions refilled, then you have to come in and see me. Every quarter,
Got you.
I need to have an update from the therapist to see how the patient is going, but a minimum of 1 to 2 years. A minimum
A
of 1 to 2
minimum.
years for someone who truly needs to be treated for anxiety or depression. A minimum of 1 to 2 years before you consider
Hmm.
titrating them off or weaning them off. So it's
So,
not like, oh, my kid is stressed and I just want them on this medicine because I have anxiety. I'm on the medicine and my kid is just like me.
yeah.
And I have had that too.
Give
I've
them a
had
little
that too.
Xanax, they'll be all right.
A little Zanny. Mm-hmm.
Yeah,
Mm-hmm.
I 2 years is a long time. So someone said in
Mm-hmm.
the comments that they think they'd be nervous about medication in kids. So what is your response to that?
You should be. You should be, because it's not the first line of therapy. It's
Right.
not the
So
first line.
what is the first line in your
That would
professional
be
opinion?
the cognitive behavioral therapy.
Okay.
CBT is the
CB,
first.
right? Somebody put that in the
CBT,
comments. Yeah.
cognitive behavioral therapy, is
Therapy.
where you start. You start with cognitive behavioral therapy, finding out what
Mm-hmm.
is the root cause of your child's anxiety. Now, there
Right.
might be, now I'm not talking about kids who have many things that are going on, who are complex. Those you might need to, that's a whole nother thing. That's a
Yeah.
whole nother thing where you
Yeah.
start the therapy and you might need to do medication first before you can even get to the therapy.
Mm-hmm.
That's not what I'm talking about now. But for those who start with cognitive behavioral therapy and it's not getting to the crux of it, or they just need a little bit of help because their anxiety is through the roof, to the point where they cannot function, where they cannot go to school, where they
Yeah.
cannot be in public. They're just shaking, they're anxious, they're just those
Like extreme.
those yes, those extremes. You start the medication and you do the therapy at the same time. But
Mm-hmm.
for most of them, you send them for the therapy first. Now let me give you a scenario.
Okay.
These days in high school, children take advanced placement classes and they take honors classes,
Yes.
and they're worried about maintaining a super high GPA so that they can get into the best college, right?
Mm-hmm.
A lot of these kids have so much homework and so many of these classes that they are stressed beyond belief. Stressed beyond
Wow.
belief. And I have some of those parents bringing those types of children into the office for medicine because they want them to take all of these classes so their GPA is higher than a 4.0, because they have all these honors and advanced placement classes. And then
Mm-hmm.
they're so stressed and they need to be on medicine. And I've told the parents, I am not going to medicate your child for that. Your child needs to talk to their guidance counselor
Yeah.
and manage their coursework, because we know what the source of it is. And I've also had patients where I've told them, you know what? Next year, when you go to college, you are going to feel so much relief because you're not in school from 7:30 until 2:30 with class to class, back to back to back
Right.
to back, all these high intensity classes. You'll have a class where you'll take Monday, Wednesday, Friday, Tuesday, Thursday. You'll put spaces in between your
Yeah.
classes. You don't have to get up at 7:30 in the morning, and your life will be so much more balanced. Right now, it's just not balanced because you're just taking all of these classes, or you have children who, let's say athletes. There are parents who have their children in, you know, their school sport and then a
Mm-hmm.
travel league. They play school soccer, they play club soccer, they're on
Right.
a travel soccer league. Even with track and field, even with basketball, they have football now. In the fall, you have football in the spring.
Flag
It's just
football,
a
touch
lot.
football, a
Yes,
lot.
it's just a lot on top of schoolwork. And there's just so much that our children are involved in, and we just push our children so far. Sometimes it's the fault of the parent, and the parent needs to take a step back and say, am I trying to be that parent that says, well, my kid is doing this and my kid is doing that,
Yeah.
and I'm pushing my kid too much? Maybe I need to fall back and let my child know, you don't have to perform to this level. You don't have to do a sport every single season.
Right.
You don't have to do so much in addition to all of this schoolwork.
Because it becomes a
Balance.
lot. It
It
becomes
becomes
a
too
lot. I
much.
remember my daughter's on here and she super smart and she started doing these honors classes and
Mhm.
they were really kicking like one of the I think she did 4 and like 2 of them were really kicking her butt. Like it was a little tough for her to keep up with them and she was like, "Mom, it's a lot." And I was like, I didn't even take an honors class in school. So I was at
Mhm.
algebra and all the rest of that. And she's in honors in like
Mhm.
ninth grade.
Mhm.
And I'm like, you know what? If you don't want to do the honors class and it's too much for you, it's okay for you to say, I would like to go down to the next level. If you want to go down the
Mhm.
next level in all of them, it's fine.
Mhm.
It's your
Mhm.
classes and
Mhm.
it's a lot of stress.
Mhm.
For kids to have 4.5 GPAs,
Yeah.
like that
Yeah.
is not that the kids aren't
Mhm.
smart or whatever, but the
Right. Right.
pressure,
Mhm.
it's a lot of pressure. And like you
It's a
said,
lot.
parents have to be like aware
Mhm.
to not put that pressure on their kids.
Yes, I had to do that with my son's guidance counselor. He's at a technical high school doing a
Hmm.
pre-engineering track, and I look at, what are your classes for next semester? It was like, okay, well, you can have those two math classes, but they don't need to be honors or advanced placement, or you're
Right.
not going to have honors chemistry and honors chemistry and honors physics. We're not doing that.
Because
So
why are
I know
we in
you have
honors
to take a
history? What is going
right.
on?
Right. Exactly. Exactly. And so you do. And he maintains it on the principals list or
Hmm.
the honor roll or whatever it is that you get all of these marking periods, which is really good. But as his parent,
Yeah,
I look at his schedule and I say, no, you are not doing that.
I
And
love that.
he took Spanish as a sophomore, Spanish one as a sophomore, because I didn't want him taking a foreign language as a freshman. So I
Hmm.
said, no, you can take your foreign language as a sophomore and then again as a junior. And his counselor said, well, you don't have to take part two in your junior year. You can take it in your senior year. And I said to my son, no, if you take part one as a sophomore, we're not going to lose what you learned in your junior
Right.
year, nor am I going to have you frustrated as a senior because you have to take this foreign language part two to graduate.
Right.
And then you're stressed out about it. No, we're going to do it sophomore year and junior year. And then your senior year, there will be no
Hmm.
foreign language. And so as a parent, knowing balance and knowing your kid and knowing
Yeah.
that you don't want your child overly stressed as a senior, because senior year is just stressful in and of itself.
You're
But
right.
you don't have to have that kind of added stress. So parents just need to even be, looking at their children's coursework and deciding, what is too much, especially if your child is also involved in a sport. Because again, it's not all academics and it's
Right.
not all sports. If your child is involved in a lot of sports, they need to perform well academically, and vice versa. It's a balance.
It's a balance. So we
Mhm.
are going to, I love that you said that. It's a
Mhm.
balance of, learning your kids. So we are going to go to Karen Prather. She has a
Mhm.
question. She said, do you find parents are more receptive to the idea of allowing their children to talk to doctors and therapists alone as opposed to some generations before today?
I think that more and more parents should understand the boundary and giving their child space. I
Hmm.
think that if and you have to know your child and you have to be able to trust the process and
Hmm.
trust the mental health care provider that you are sending your child to. I think that that's where it comes in. If a parent doesn't trust or doesn't know, then their
Hmm.
guards are up, because as a
Yes.
parent, that is what you do. That
Right.
is what you do. But once you are in a relationship with a provider where you trust them and you trust your child. Now, if your child's going to go in there, hmm,
Right.
I'm not talking, this is not a fit, you might get that in the beginning. But once you break that, and if that's repeated over and over again, then that patient therapist relationship is not a good one, and you need to look for another one for your child. But once that relationship is established, you need to let it go. You need to trust that you have taken your child to a healthcare provider that you trust, and that you trust that they are educated enough, they have the fund
Hmm.
of knowledge, that they have the experience and the wisdom to not lead your child in the wrong direction.
Gotcha. That makes sense. So you need to trust your primary, your
Trust
physician. You
them.
have to trust them, even
You have to
if,
trust them.
yeah, there has to be some level of trust there because you are,
Mhm.
I mean, in actuality, you are sharing your child because they are giving them medical attention and medical information. So you are
Mhm.
definitely trusting them and their care to your kid.
Yes. And I'll
Uh,
say this
Go
too.
ahead.
My children are 13 years apart, and so my older son Justin, actually, when I graduated from college, he was present. I had a child. I'm sorry. When I graduated from medical school, I had a child while I was in the medical school. Still graduated with my class on time.
Hello.
So that's a whole nother conversation. But so I graduated, I became a mother, and then I became a doctor. And so because I've been on this job where I am now for 25 years, and my son is 29, he had a pediatrician when I started. And so
Hey.
I was not that person. It was a
Mm-hmm.
woman. And there would come a time when my son would tell me, his pediatrician mother, Mommy, I'm sorry, but you're not Dr. I don't want to say her name.
Right.
You're not Dr. So and so. Could you please make an appointment for me to see her? Okay. So he had a great relationship with her. And when I joined this practice, I didn't switch him over to my care. He stayed with that doctor from the time he was just under 2 years old until he aged out of the practice. And I did not interfere. I did not interfere.
Oh, I
And
love that.
I'll just say that she looks like me. That's all I'll say.
That
Um,
helps.
and then my son Joshua, who was going to be 17 in August, comes to my practice, but I am not his pediatrician. I have never been his pediatrician. He has the
Gotcha.
same one that he has seen for all 16 years of his life. And he
Mm-hmm.
too will tell me, Mommy, can you make me an appointment to see Dr. So-and-so for something? I'm going to say this most recent thing was acne. And I said, well, Joshua, I kind of know how to tell you what to do about your acne. And he's
Been
like,
doing this a long time.
can you make me an appointment with Dr. So-and-so? And I'm like, okay. So even as his mother pediatrician, he has his own pediatrician that he trusts and wants to see, even for acne, even though I can do it.
Just, I
And
can
I'm
help
okay
you
with
here
that. I love it. I love it. I'm okay with that. I'm
because
okay with that.
he has a trusting, safe space over there with his
Mm-hmm.
pediatrician.
Mm-hmm.
And it's building relationships, right? So, like you
Right.
said before, you have to have a good cohesive, a good fit. Like Helena
Mm-hmm.
was saying, there has to be a good fit.
Mm-hmm.
So, with these, so once the person or the adolescent, is that's the
Mm-hmm.
word we're using,
Yes.
adolescent.
Yes. Yes.
Once the adolescence is referred to therapy,
Mm-hmm.
right? They're referred to therapy first. Is the
Mm-hmm.
first step. We'll refer them over there to get to the root of the problem.
Right.
Okay, and then after that, there should now. How long? I know that's not your wheelhouse, but they will be over there for however long they need to be.
That's it. For however
Yes,
long it takes for them to accomplish their stated goals.
and the parent has to be patient, right?
Yes.
The parent has to be
Yes.
patient so they can work through it.
Yes. It's a
In addition,
process.
it's
It's
a
a
process.
process. It's a process.
Yeah. Okay.
Trust the process.
I think because a lot of times we're kind of looking for. We live in a microwave world.
Hmm.
So we're looking for something instant, some instant
Yes.
results to
Hmm.
happen magically because I don't know if we're not paying attention or didn't pay attention or we just seen the signs. But
Hmm.
where I would look for something, would think I would look for something magically. Hey, you're sad. Let's go over here. One
Hmm.
treatment, two times you talk to the person. All
Hmm.
right, you feeling better?
Hmm.
But you have to let them work through that process.
Hmm. And there are some serious things for which adolescents need to seek help. So let's. I'm going to transition to depression right now. So
Okay,
when we're talking about depression, depression is different than anxiety. Okay,
got you.
I could have a patient who comes into my office and I send them to crisis because it is not safe for me to allow them to go back home. So,
Crisis,
and I'm
crisis being who? What's
crisis
crisis?
being there is in the area where we live, Jefferson Hospital in Washington Township and in Cherry Hill, both have adolescent crisis. You can go through the emergency room and be seen for behavioral health, for mental health crisis.
Got
In
you.
Jefferson Hospital in Cherry Hill actually has an adolescent a wing where you can be admitted for adolescent behavior health, short-term adolescent behavior health. And
Oh.
yes, so it can be a dangerous thing. And there's a lot of things. I mean, you wouldn't believe, children get bullied in school, and it makes them not want to be here anymore. It makes them want to cut. It makes them think about not being here. A
Yeah,
lot of times children cry out for help. They'll go and they'll take a substance. They'll swallow a
right.
substance.
Yeah.
It might be even two or three of them, which which I know as a physician won't hurt them, but they don't know that, but it's a cry out for help. Um, those are significant things. There are children who are concerned about being in an in group. They're in an in group and then they're out of the in group. Especially with girls, this happens a lot with girls. Girls
Oh,
are
that
very
mean girl.
concerned about
Yeah.
image and fitting in and being
Mm-hmm.
popular. And let's not even talk about the filters that you use, even adults use before you make a post on social media. You got to filter it up. You got to get it looking right
Gotta clean it
because
up. Gotta make me
got to
look.
clean it up, right? And
Yeah.
the kids, adolescents do the same thing. They see these images on social media that just
Mm-hmm.
aren't reality. I had a patient who was a male high school student who went on. Uh, I don't remember what platform it was on, but he went on a platform. He was a junior in high school. He
Mm-hmm.
went on a platform and met a woman. We are in New Jersey. She was all the way in the Midwest somewhere.
Okay.
Met her and assumed that he was in a relationship with her, and then and that she broke up with him. But then he said that when he thought that she was breaking up, it was that they were never really in a relationship. But he ordered medication online. I couldn't believe that he could get it online. He ordered drugs, a controlled substance online, and took it. He took it in the
Oh.
morning, and then he went to school and he told somebody at school what he did. And then he came in to see me because he was depressed because a person whom he had never met broke
Mm-hmm.
up with him online. He was rather socially awkward and would never approach a girl in his own school
Right.
to into a dating relationship. So this happened online, and it
Oh.
turned into a big thing. It turned into a big thing where I sent him for counseling, and he was on medication for his depression for something like that. So you got to think about the older adolescents who have
Yeah.
a lot of weight on them. Older adolescents who are going off to college. I've had some who fell into deep depression because they were the second or third child who had to go off to school, and they knew that their parent was already struggling to finance the older two siblings going to school. And so
Wow.
for them, it was the weight of, how am I going to get scholarships? I'm not smart enough, but I do
Yeah.
know that I want to go to college, and I might not be able to go because my parents can't afford it, and I feel like I'm a burden to them. So
Wow.
those are the kinds of things that come up when I do my screening assessment, a 9-question screening assessment on my older adolescents. And then now we gotta work through that.
So can you tell me where, because the young person met someone on social media, how
Mhm.
is social media, like, do you see a lot of social media dealing with like anxiety and depression with
Of
your
course, of
patients?
course, you see a lot of it when I have patients who come into my office, and I have to say, "Can you please put your phone down?
Wow.
Can you please put your phone down while you are in this room?" Or I'll be
Hmm.
doing their exam, and their phone will vibrate on the table, and they'll pick it up, and I'm like, "Nope, I want you to put your phone down, face down on the table for the
Yeah.
duration of the time that you were in the office with me, because we need to focus on some things that are important right now in this room. I
Hmm.
promise you, you will be okay if you don't pick up your phone." And for some of them, it's a challenge. And
Yeah.
for some of them, I would say, "Do I have permission to touch your phone?" And if they tell me yes, I say, "Okay, I'm going to take your phone and I'm going to put it on my desk," which is not on the exam table that they're sitting on. I'm going to take your phone and I'm going to put it face
I
down
like
on
that.
my desk, and then I will give it, but I would never touch anybody's phone without their permission. I would
I
never
like
do
that
that.
you ask. I
I
think
would never
that
do
is
that.
so lovely. I
I would
think
never do
you
that.
it established like the boundaries and relationships. Okay, I'm going to ask
Hmm.
this stuff,
Hmm.
because a lot of times kids are told and not
Hmm.
really asked the permission of in granting permission.
Hmm. Hmm. And you have to, and I try to let them know that, you are important to me. Your time here in this office is
Hmm.
important to me. And a lot of times with, I'm going to say, my African American males, I have to have a lot of conversations with them about what is expected of them in society, how you
Mm-hmm.
are perceived the moment you walk through the door. Your blackness precedes your maleness, and you need to understand that. And
Yeah.
people are going to judge you based on what they see before you even open your mouth. So your appearance means something, your
Mm-hmm.
yes means something. You don't shake your head, you open up your mouth, and you represent yourself well. It's not always about, you better represent, who your parents are, you better represent your parent. You need to represent yourself well.
I
And if we
love that.
teach our adolescents to have control over themselves, then
Yes.
that's the first thing. If you don't represent yourself well, you're not going to represent your parent well, your grandparent well, your school
Yeah.
well. You know, it's about you. And I have to tell my adolescents, if they're, some of them are getting into some trouble, they're getting suspended from school,
Mm-hmm.
they're you know now in New Jersey, the possession of a small amount of marijuana is not a crime. But before that law passed,
Yeah.
had to talk to them, about that. Or my children who have been through the juvenile justice system or who have been in a group home. I talk to them because I have personal experience with family members who have
Mm-hmm.
gone that route. And I've had young adolescent males, young adult males crying in my office that I ask permission, can I hug you? Like, when is the last time somebody gave you a hug? I'm Dr. Hill and I love you. Can I hug you?
I love
and
that.
and it's okay if you hug me back, and it's okay if you don't. But I'm a mother and I'm a
Mm-hmm.
physician, and as a mom, you need a hug, and I would like to hug you. May I hug you? And then you
Right.
just feel the weight just like rolling, down their shoulders, just like you feel like you see the
It's a
tears come from
weightlifting.
their
Yeah.
eyes. And it makes a difference. It makes a difference. Every little bit that I can do to help when they're in a space with me in the office, that's what they get. And
You are so
sometimes,
impactful. I love
thank
this.
you. There are times when I've had, and this was rather, I'm going to say probably 20 years ago, I had an adolescent female who was dissing her mother so badly in the office, the mother started crying. I had to ask the mother to leave the room. Can you go in a waiting room?
Mm-hmm.
And I said to my patient, I don't know what you were accustomed to doing when you were outside of this office, but when you were within these four walls in my room, you will not talk to your mother like that. I will not allow you to talk to your mother like that.
Yeah. Respect.
You will respect her. You will honor her when you are in these four walls. Do you see that what you have said and your actions have brought your mother to tears? You have brought your mother to tears. And if you did it in front
Yeah.
of me, I know it's not the first time you did it in front of somebody else. But when
Right.
you walk in this office with me as a physician, that is not acceptable.
And I
It's
love
not
that you
acceptable.
establish boundaries even with the patients, with their
Hmm.
behaviors and what's
Yes.
acceptable and what's not acceptable.
Hmm. Somebody needs to tell them that, then I call for the mother to come back into the room.
Mm-hmm.
But and I told the girl, I said, you can tell your mother what I said to you if you want to. That's up to you. You
Yeah.
heard, where I stand. I'm gonna bring your mother back in the room and we're gonna finish our visit. But what I said to you, once again, that's between you and I. If you choose to share it with your mother, so be it. If not, at least you heard it from me.
I love
Food for
that.
thought.
No, that was
Mhm,
amazing, and I really
mhm,
like
mhm,
the hug part really resonated with a lot of the comments and the viewers because just to be as personal as you are with your
mhm,
patients. Karen asked, she said that she can remember adolescence was answered with "Ain't nothing wrong with you," and you better fix your attitude. So,
mhm,
like, we are
mhm.
finally being listened to and taken
Yes.
seriously, and I think it's important for representation in the community so you can definitely identify as with your blackness first and then you're a
Mhm.
doctor and you're a woman, so all of that, like,
Yes.
you have such a beautiful view of your patients and of your practice, and even, you know what I mean,
Mhm.
the relationship you have where you can identify.
Yes.
with your patients. So if you guys want to put your questions in the comments for Dr. Hill, she is here to answer any questions that you have on anxiety, depression, those type of questions that you have. Oh, someone said breaking general curses. Yes, yes.
Yes,
So
yes.
put your questions in the comments for Dr. Hill. She is here for you. She already gave her disclaimer, people. Refer to your primary care physicians, your pediatrician, your very own. This is even for her own patients who are watching. This is not that. So, so you've been in practice for how long? You said
I have been at what we call an attending physician post
attending.
all of my training for
Mhm.
25 years. After
25
all of my,
years.
yeah, I graduated from medical school 28 years ago.
Gotcha, gotcha. Okay, that's a good long time with a lot of experience.
Hmm.
Oh,
And
Summer, go ahead.
I wrote a book called Blended Beyond Expectation,
Yes.
which is it's a journey through my heart as a wife and a mother in my blended
Mm-hmm.
family experience, and a lot of and it I had to get permission from my now adult son to write the book because I wanted to be open. I wanted to be
Mm-hmm.
honest. I wanted to be transparent to help families who were struggling with prodigal children. And
Oh, I
because
love
my
that.
older son was a prodigal son, and I write a lot about some of the things. Some of the chapters in the book have to do with parenting through a prodigal child. Other
Yeah.
chapters in the book have to do with the experience, some of the things that I experienced when I blended my family, that I blended beyond expectation. I just did not expect that it would happen. And so a lot of the teaching that I do around being a family empowerment coach has to do with families of children who aren't your up and up. You know, it's not your
Right.
good white picket fence. It's not
Yeah.
your child who's always an A plus, who's beautiful, who's fine, who doesn't talk back, who doesn't kick back. I'm probably not your girl, you know, for that one in terms of empowering you because you already got that going on. But especially for women who
Yeah.
are parenting, women who got it all together, successful women who are raising their children, and guess what? Their children are still doing them. Their life is
Yeah.
lifing because their children's life is lifing. That's where this book will take you, and it's a journey through my heart, but it also takes you on a journey through yours because it's kind of a workbook type activities
I
at the
love that.
end of each one of the chapters. So it's very
Yeah.
interactive. So you journey through my heart, but believe you me, I'm going to take you on a journey through yours because both of us have to get something out of what I went through.
Yes. And that book, people, my good people, that book is available on Amazon. So take yourself to Amazon and purchase Blended Beyond Expectation. No S. Blended Beyond Expectation. No S. With Dr. Hill. She wrote a book and it is about blended families. And a lot of times, everybody, like she said, doesn't have the rosy colored glasses, picket fence. A lot of, y'all have teenagers. You've raised teenagers who, and I've been the teenager. That might be your son. I've been a teenager climbing off the balcony to go hang out. I was
That one.
a little bit
That
of a
one.
wild child. My mom, she was asleep. Is she watching? I hope not. Anywho, we do have a question from Summer
Yes.
Allen. She
Yes.
said, "Do you think puberty has anything to do with anxiety, like hormonal imbalance?"
I think that it's a necessary part of the madness that I call middle school madness. I call it typical 2 year olds because
Mm-hmm.
they're not it's not the terrible twos.
I
It's the
like that.
typical twos. They
Typical.
must go through the process of learning autonomy. That is what it's all about. It's not terrible, it's learning autonomy. So I call it the
Mm-hmm.
typical twos, and then I call it middle school madness, and then I call it high school hijacked.
Got you.
In middle school, I say this whole question about puberty and hormones. The child doesn't know if they're coming or going. Their
Correct.
body is changing, their mind is their brain is still developing. And yes, I think that the change in the pubertal hormones do have a lot to do, something to do with anxiety. And there's a level of anxiety that's good and healthy, and then there's a
Mm-hmm.
level of anxiety to push you into the realm of it being a disorder. So yes to the puberties, and yes to the hormones. And then the high school hijacked. High
Mm-hmm.
school hijacked is that kids really truly have lost their minds in high school, and they just feel like that they are absolutely invincible. They can do anything, they know everything, their
Yeah.
parents don't know anything, their parents are not cool. That's their frontal lobe that causes them to be very impulsive, to not
Mm-hmm.
be rational, to make impulsive decisions that can sometimes get them into a lot of trouble. So
Yeah.
that's your high school hijack that goes into late adolescence. And then when they're about between the age of 21 and 25, they're coming back to themselves, and they're realizing that their parents really do know something, and that they want to have a relationship with their parents.
Yeah.
And at age 25 is when that frontal lobe is completely developed, and then they are a mature adult. And actually, the last chapter of my book, in
Mm-hmm.
Blended Beyond Expectation, I talk a lot about uh, that developmental process, from childhood through even late adulthood, and what it means in your relationship, in terms of the relationship between a parent and their child.
Okay, so I have a question.
Mhm.
So, being that a few of us were high school hijacked, how
Yes.
much grace as parents on the other side who are raising these high school kids, how much
Mm.
grace can we extend to these kids who are going through so many body changes, mental change? Your brain is growing, like you're
Mhm.
on your way to adulthood, but you're stuck in that little phase where I'm expected to do so much, but I'm still like a child or
Mhm.
adolescent. Like
Mhm.
how can parents like maneuver that space?
I think parents first have to remember, just like you said, that they were in high school, that they
Yeah.
were adolescents, and have some grace to know. Just sit back and think, even if you were a little goody two shoes, I was sort of kinda. I had my, I had my, my breakout
Right.
season. For the most part, I was a good kid, but I did have my breakout season where I pushed back and I challenged. But
Yeah.
I think that a lot of times I always say, when you're drawing a line in the sand, make it a wavy line. Don't be
Ooh.
so stringent. Nothing in life is black and white. So, as a parent, when you want to be harsh and you want to draw that straight line, if
Mhm.
you cross this line, there is a consequence. Every action has a consequence. Whether it's
Right.
good or bad, there's a consequence. But I think that as parents, to answer your question, we need to learn how to draw a wavy line in the sand and give our kids some grace.
I love that. Hey, they said my mama would call it smell. You're smelling yourself. Yes. I've been told that too.
Oh
You're
yeah.
smelling yourself.
Oh yeah.
So I love that you're saying the wavy line because it isn't very black and white
Mm-hmm.
with kids and situations and however, life is life and for them.
Mm-hmm.
What about so when I have a grandkid, a granddaughter,
Mm-hmm.
and she is um going through puberty. So
Mm-hmm.
how can we as and I want to be open to her body's changing. So
Mm-hmm.
how when these adolescents and their bodies are changing in that what's the middle ground, the
Middle school madness.
middle school madness. So with the body changes, how can we be supportive is probably a good word. How can we be
Okay.
supportive of that?
Okay. The way that we are supportive is to explain to this adolescent whose body is changing, that
Even girls
when
and boys. I want to make sure we
right,
include the boys. Yes.
boys and girls. Okay,
Boys and
but
girls.
for girls first,
Okay.
your body is changing,
Mm-hmm.
and males have eyes. Males are very visual. They don't understand that you are 13 years old, getting these curves up the top, the little curves in the back, little curves on the side. They
Right.
don't. And a lot of times you'll see these girls and you're like, oh my gosh, she's only 13, she's only 14. You know, this is what happens when our body changes.
Yeah.
There are the two main hormones that we talk about are androgens and estrogens. Androgens are male hormones that we have. Males and females have both. So men have estrogen and women have androgen.
Okay.
Androgens are hormones that are responsible for body odor and hair
Mm-hmm.
growth, which is
Okay.
why you can have that little 6-year-old whose armpits smell like a hoagie,
My God.
and you can say, you need some deodorant. And you say, and I have, Dr. Hill, what do I do? She smells like a man.
Why she
Okay, well,
smell
there's
like
something called Teen Spirit, Arm& Hammer,
that?
Dove. So they do make deodorants for when those androgens are getting out of control. And it's the same thing when you see the little girls that have the pubic hair. Little
Yeah.
fine, stringy pubic hair, that's androgens. That's a male hormone. And it doesn't mean that, oh my God, they're getting ready to have their period. And that's okay. So androgens are responsible for hair growth and body odor.
Mm-hmm.
Estrogen, on the other hand, is responsible for bone growth, breast development, and the proliferation of your uterus for your menstrual cycle. So the first
Oh,
sign of puberty in girls is breast development. So
right.
when you see those buds, this is when little things should start. Oh my Lord, it's coming.
My
So it
Lord.
affects the breast tissue first.
Mm-hmm.
It affects the long bone second. So they will have a growth spurt.
Ah.
And in middle school, in males and females, the way the body grows, you grow from outside.
Where you at? Where you go? Where you at? Where you go? Go from the outside in.
And then your torso.
Mm-hmm.
So their shoe size increases. You be like, I just bought you them pants. I can't believe you outgrew them. You only had them for 3 months.
Right.
And then you're going to see a menstrual cycle. So once you go through that in girls, and the estrogen is going to give them those curves, it's going to give them that attitude. And so you have to remember that you are a woman who was once a girl. And so you knew what it
Yes.
was like for what you were going through, but I still think that girls should be taught how to wear proper undergarments. They are there for a reason, and to wear clothes that
Mm-hmm.
are flattering, that fit. I think too many girls are not wearing the proper undergarments even when they're in middle school, and they are
Yes.
wearing clothes that are too tight, that are
Mm-hmm.
very suggestive, and then we get upset when the girls are out somewhere and a grown man is paying attention to them, making comments, because they're not looking at the face and understanding that this is just somebody who's 13, 14, 15 years old. They're not a grown woman. So
Yeah.
a lot of it, for every woman who has a daughter or the granddaughter, just really talk to them about the changes that estrogen is doing on their body. They have
On
to
their
go through. I
bodies.
have
Yes.
girls who start their menstrual cycle so early, they don't want their boobs, because they started their menstrual cycles when they were 10, and they're getting in the way. They're jumping, they're running, and the boobs are in the way, and they want them gone. Whereas their friends who are
And
14 years
did.
old, and they're like, I don't have my cycle yet. So, what's wrong with me? I'm still flat chested. That was me, late
Yeah.
13-year-old. And so there different ways that the estrogen affects the bodies at different timings, and just to
Yeah.
talk to their girls about their bodies and to really keep themselves. They have to be the keeper and the respecter of their bodies.
Of their
And if we
bodies.
as women are not teaching them, then the boys and men are not. And then so boys,
I love that.
puberty in boys begins with penis development. That's the first sign of penis growth. I'm sorry, it's already developed. Their penis will grow.
Yeah.
And so you don't see that. Girls, you see their boobs. They're
Yeah.
going through that. But boys, their penis is going to grow. They're going to start having wet dreams before you even see the facial hair, the voice changing. And
Right.
so if you are a mother of a
Mm-hmm.
male, and they're hugging you all of a sudden with some space in between because they're having these erections that they can't control, you know, every woman is like, he don't need a father. He got me, he got his mother. Well, in puberty, he needs a male. And if you can
Yeah.
find a male to really talk to him about what his body is going through, those hormonal changes, things that they can't control, the attitude, the feeling themselves,
Yeah.
he needs to talk to a male. He needs to talk. A woman can do it. I understand the physiology of the body, but I'm not a male.
Right.
I'm not a male. And so those kinds of frank conversations. Now, don't get me wrong. I have no problem talking to my patients about it because this is what I do. As a physician, I'll have those conversations about your body changing, about sex, about smoking, about vaping, about
Yeah.
alcohol, about all of those kinds of things. But when you're really trying to get somebody to understand their body that's going buck wild, we cannot be afraid to talk to our adolescents and in this case our tweens about what their
Your
body is
tweens.
about to go through.
And be supportive of what they're going through.
Mm-hmm.
Yeah, because one of my kids, won't say which one, but one
Mm-hmm.
of my kids, like they would literally have their hands in their pants all the
Mm-hmm.
time. And I
Mm-hmm.
was like,
Mm-hmm.
what are you doing? And I'm thinking, oh, it must be down
Mm-hmm.
there doing something.
Mm-hmm.
And they're like aware of it.
Mm-hmm.
So so what if your kid like is doing that and becoming aware of their body?
Mm-hmm.
What is your
Mm-hmm.
suggestion?
Well, I'm going to back it up because I'm going to take that all the way back to 3 and 4 year olds,
Okay.
because that's when 3 and 4 year olds start to fondle. Girls and boys will start to fondle, and a
Hmm.
4 year old can have an erection and they can play with their little penis down there, and girls
Right.
can fondle and feel good. And parents will bring them in. Dr. Hill, they're masturbating, or they're playing with themselves, and I'll say, "Well,
Right.
that's called masturbation." Oh my God! Well, it's called masturbation, and that's what they do. And I will tell parents, you have to tell them, if you're going to do that, you need to go to your room. You don't do that in public where other people
Hmm.
can see you. I understand that you enjoy the sensation that comes with it, but please go to your room and do that. And then, when you are finished, go to
Yeah.
the bathroom, clean yourself up, wash your hands, and then you can come back around. But what you cannot do is make it taboo, because
Right.
then they'll be, doing it in secret with magazines and all this kind of stuff. We're not going to
And the
try
lotion
that
in the room
taboo.
and socks and
Right.
what is
And
going
long
on
and
in here?
showers. Yeah, yeah. The socks are, filled with stuff in the morning. All these extra socks in the
Where
in
are
the
these
in the,
crunchy
in the
socks
hamper.
around here?
Yes. Yes. So you have to let them know that this is part of their body change and they are going through puberty, and it is perfectly normal. It
It's
is not
normal.
taboo. Your
Yes.
body changing is not taboo. And the sooner you begin to talk to children about their bodies and their
Hmm.
body parts and make them comfortable with it, they'll want to talk to you about it, and there'll be no shame of, oh my God, you can't talk about this in mixed company. Go somewhere, go somewhere. Don't talk
Right.
about that. Listen, it's 2024, people. If you don't
Yeah.
talk about it, guess what?
They're going to learn it
They'll go
somewhere
somewhere.
else.
They'll learn it somewhere else
So
in a
do
perverted
you
way.
and potentially in a perverted way? Correct. What do you think about calling the body parts by their names or the nickname thing? Like what's your thoughts on? Oh, you shook your head
Names.
already.
Names. I had a parent who called her daughter's vagina a purse. I said, well, it's not a purse, and we don't put coins in it. So it's called a vagina.
Right.
That's what it's called. And a male body part is called a penis. And they're
Gotcha.
called testicles. They're not balls. That's well, Dr. Hill, his balls, well, they're not balls. They are testicles in a scrotal sac. That's what they are. It's the
Oh.
testicles. And so when a kid is in a bathtub and they're trying to pull these testicles, the scrotal sac, well, they don't come out. Their testicles in a scrotum, show them
Hmm.
pictures, and to just use the words that they are. And the girls, and then even with girls, you have to be careful, because a vagina is
Hmm.
the internal part of their genitalia, where the vulva is the outer
Right.
part. So we don't say, you don't have to say a labia, you don't say lips. You can call the entire area is the vulvar area. Do you have irritation in your vulvar area? When you're learning to wipe, you wipe your vulva from front to back and not from back to front. So it's not a kitty cat, it's not a pocketbook, it's not a tutu, it's your vulva area. you insert a vagina, you insert a tampon into your vagina, you insert a penis into a vagina. And I have conversations with my male patients that if you are pulling your penis out to pee, thing besides pee at your age, then you're being irresponsible. I have that conversation with all of my middle adolescent males.
I love that.
Unless you're going to pee, you are being responsible and your penis belongs in your pants. And I say that to them and I tell them, I say, you guys are too young to remember the cartoon, the Flintstones and Mr. Kazoo, the little annoying guy. I say, I want you to hear my voice. If your mother doesn't say this to you, I want you to hear Dr. Hill's voice. Am I being responsible with my penis? Am I being recreational? Am I peeing, or am I getting ready to do something with it that I shouldn't be doing? Or do I have a condom to put on it? If you're not pulling your penis out to pee, you're being irresponsible and recreational when you are 15 years old. That's what you should be doing with your penis. And you're going to hear it from me. And I want you to remember that annoying thing that Dr. Hill said.
Right. I'm Kazoo right here.
That's right.
Dr.
Right
Hill
there.
on your shoulder. So, all right. So, okay. So what do you think? Here's my, what do you think? If you guys have questions, please put your questions in the, comments. Put your questions in the comments, please. Put your questions in the comments. What do you think about the bathtubs and stuff? Like the kids washing, like when is there an age when the same sex washes together and then they should start not washing up together?
I would say 3. After age 3, I think that they should bath separately. Because like I said, things start happening. Boys can have erections when they're 3 and 4 years old. So if things are happening with their body, you don't want things to be happening and it feels good for them to touch it when they have an erection. And then they're in a bathtub with a girl and things are feeling a certain way and they think that it's okay to have the girl touch them.
Yeah, I got you.
Or vice versa. So
yeah. So
just extra bath water. Have 2 separate baths.
2 separate baths.
It's worth the water.
Right. So back to the puberty and the body's changing and anxiety. So can that cause anxiety for like
sure, absolutely, absolutely. Like I said, for the girl who remember, the first sign of puberty in girls is breast development, which is a sign that you're getting more estrogen. So if a girl starts to get her breast development at age 9 or 10, let me just back up. Breast development before the age of 8 is considered precocious puberty. At age 8 is not precocious. It's just early puberty, just like at age 14 is not late. 15 is late. So let's say you have a girl who's developing and she starts developing her breasts at 10 and 11. She has her menstrual cycle. So her body is developing and she has the anxiety because her breasts are bigger than her friends. Or if she wants to run, like let's say she plays a sport and she's running and she's got these boobs that are, moving all around. She's trying to put on a bra and then she's trying to put on a sports bra and all of that kind of stuff. That can cause anxiety for girls who develop sooner than others. The same way where girls who were late bloomers who aren't developed have anxiety about their body. And like I said, your hands and your feet grow first and then your extremities. Take a look at kids in middle school. They're very lanky. They have short torsos and their arms and their legs are everywhere. And kids are like conscious
all
about
arms,
that.
legs, and feet.
Right. And then boys, their voice changing can give anxiety. Boys in a locker room, the first sign of puberty is that your penis begins to grow longer. Well, the boys who have it and their penis is growing, well, they like to show it. The boys who aren't, they're feeling some kind of way in the locker room because they're not showing it. Male gynecomastia, where you get breast tissue development. A lot of kids in middle school, early high school, they're in the locker room. They don't want to take their undershirts off if they wear them, their shirts. They don't want to take them off because they got male boobs. And that has some anxiety for a lot of males. There are some where I say, this is abnormal breast tissue and it needs to be removed. But the majority of male gynecomastia, the breast development is going to go away. And they just have to They just
Got
have
you.
to, kind of move through that. But yes, that's a source of anxiety. There are some males who develop their muscles a lot sooner than others, and that's just, of course, the ones that have the muscles, they're walking around and they're, and the ones who aren't, they feel like,
Yeah.
something's wrong with them, and now I want to do protein shakes and take creatine and all this kind of stuff, trying to build themselves
Trying to
up
build the muscles
because
up. Yeah.
they're not allowing puberty to take its time.
Because how long does puberty really take?
Well, it can last until the beginning of college. There are, if you see, um, especially males who go off to college and then they come
Mm-hmm.
back and they're taller, they're
Right.
still in there. That's late adolescence.
Because they
Late
can come back a whole
adolescence.
different person.
hmm Late adolescence.
Yeah. Okay.
Through even 19, teen,
Yeah. Teen.
18, 19.
Right.
Yeah, that's late adolescence and your body is still changing.
Okay. Yeah. Okay. That makes sense. We have a question here.
hmm
Why do some young men have such a strong odor of testosterone? It's the question.
Well, testosterone doesn't have an odor.
Okay.
Yes, androgens have odor.
Yes.
Right. So
Androgens.
androgens are the male hormones that are responsible for body odor.
Mm-hmm.
Testosterone is responsible for testicular growth, penile growth, muscle, the bulk of muscle. So when you have males who don't have their muscles built up yet, their testosterone level is just taking its time to get to where it's going. But
Ah.
androgens are responsible for body odor, acne, facial
Mm-hmm.
hair, those sort of kinds of things. So, and the reason why some have a more of a stronger odor than others is because they have more of the hormone.
Okay. Okay.
hmm
I like that. So
hmm
can we talk about depression?
hmm
Depression in our kids that are like pre-adolescent, the
hmm
tweens are how can we like see depression with them?
Usually, kids who are that young, there are circumstances around them
Mhm.
that cause them to be depressed. Some kids are feeling um, abandoned in the midst of a household. They're not seen.
Yeah.
They're not seen in the middle of a household. A lot of times when you see depression in a young child, they're not seen. Children need to be seen. Children need to be heard. Children need to be respected and cared for. A lot of times you'll have children who are what I call melancholy. Melancholy is, it's not depression, but it's if you want to say a stair step before, where they're
Mhm.
feeling withdrawn, where they're feeling disinterested in being around other people, disinterested in doing things that used to make them happy. It's kind of a I could care less, a nonchalant kind of
Like blase.
blase,
Yeah.
like I don't really care. You need children are normally happy and engaging, and when
Yeah.
you see a child who's not happy and engaged, and they're kind of withdrawing from things, you have to worry about there being some issues, and that's a time when a parent can bring them into the doctor because they have a concern that can begin to be addressed. Because children can go to counseling too, you know.
Yes.
They can go to counseling, and then children too, younger children have behavioral problems that can present as anxiety can look like behavioral problems. A child acting out,
Ah.
a child
Yeah.
getting in trouble in school, a child biting. Let's
Mhm.
take it back to lower ages. A child biting who's in daycare can be a child who's anxious. A child who bullies, a child who teases is can be a sign of anxiety or early sign of depression because they don't know how to verbalize some of the things that are difficult for them that they may be experiencing internally or in
Got
their
you.
homes.
Anxiety can
It
look
can
like
present in
behavioral
behavior
problems.
problems.
I
Yeah.
like that.
hmm
Okay. Well, I appreciate that awareness because I really didn't
hmm
really think about,
Yeah.
behavioral with anxiety.
Yeah.
Um,
Everybody is not a baby kid.
right. because they're not. You have to
Right.
get, like someone said, you have to
Right.
get to the root, get to
Mhm.
the root of the problem. Miss Linda
Mhm.
Mack on YouTube asks,
Mhm.
does cannabis alter cognitive development? She says she lives in Philadelphia and she rides the bus and there's always a smell of cannabis on the kids.
Mm.
Can we
Yes.
talk about it?
Cannabis. Yes. Cannabis. Children's brains are not fully developed until they're about 25 years old. So if you have a child, an adolescence,
My God,
when
25?
my yes, that frontal lobe, their frontal lobe
25.
is not fully developed until you are 25 years old. So that's a whole nother conversation about our juvenile
It is.
justice system and what and all of that, and our kids and yeah.
Yep.
So whole nother conversation. um, but yeah, yeah. I'm gonna put a pin in that
Yes,
for
we'll
talk.
pin that and run
I'll
it
put a
back.
pin in that. For the cannabis, children, adolescents now, a lot of them are vaping. There's a lot of danger with vaping and vaping associated pulmonary vaping associated pulmonary syndrome,
Okay.
where these kids are vaping nicotine,
Mm-hmm.
um, marijuana, things are laced in there. And then there's other like heavy metals and other things that are also in the liquid that's in the vaping thing that you use that are
Yeah.
damaging to your lungs, that are damaging to brain development. Anytime there is something that is still developing and you're ingesting something into your body, it can have an effect on that. The irritability, a lot of times,
Wow.
my patients will tell me that they smoke every day. Just like, people used to smoke a cigarette and used to think
Yeah.
nothing of it.
The
There's
chain
20 cigarettes
smokers.
in a pack. And we
Mm-hmm.
used to say, how long does it take you to get through a pack of cigarettes? There's 20
Right.
in there. How long does it take you to get through a pack? And it would be acceptable that somebody smokes cigarettes. Well, now these kids are smoking weed, and some of them smoke it every day, every day because they say it relaxes them. And it's not illegal. I have to tell parents that smoking weed is not illegal. It's something that your kid is doing, but it's not illegal anymore. And you have to be careful about it. The kids will go to school, and of course, you can't, smoke on school grounds. They
Right.
send you out. They want to get a urine test. Okay, yeah, the urine is positive for cannabis. You do a spot check on a lot of teens, and their urine
Yeah.
is going to be positive for cannabis. You don't send them to hell. There's that wavy line.
The wavy in the
It
sand.
is a gateway. It is a gateway drug. It can
Mm-hmm.
lead you into harsher things. Absolutely. I'm not saying that we need to dismiss it, but we don't need to send our kids to hell for doing it either. We
Yeah.
need to have a little grace. What I do get concerned about is if my patients come into the office, and sometimes I've said this about parents. I'm like, well, did you have a little weed with your breakfast this morning? And I'm telling you, I say it because I want either my adolescent or the parent
Mm-hmm.
who comes in with a child smelling like weed,
Right.
that I know, that I don't think that I don't know. I
Right.
smell it, and I want you to know that I smell it. And if it's a pretty strong smell, I might say, well, do you need some help driving home? Are you okay to drive home? Because you brought this kid in here and you smell a little strong. I had one patient that I said it to, and she was a new mother. And I was concerned that she smelled so strongly of marijuana first thing in the morning. I asked her, and she started crying. And she said, Dr. Hill, do I really smell like that? I have my boyfriend's car, and he smokes in the car. So even to bring that to the forefront, you have
Yeah.
to say it. You can't just have the medical assistant say, Dr. Hill, they are lit. You're going to get a contact when you go in that room. So if my medical assistant says something, then I know, you know what, I'm just gonna go ahead and address this.
Yeah.
And or sometimes I'll say, you know what, you a little lit. Don't come in my office lit no more.
Right.
You got an appointment to see me. Don't come in here lit, because that's disrespectful to me. Don't
Yeah.
do that to me.
And that's
So you
respecting
just
your
got
boundaries.
right. You have to not criminalize things that our adolescents are doing. You have to not, but vaping, 100% should not be vaping. There are long-term effects to it. I know it's not like you're dragging on a cigarette, but it's still, I
Yeah.
really counsel my adolescents about sex, vaping, alcohol, and and depression.
So do you think they're vaping and smoking weed to mask like anxiety, depression, is peer pressure, that type of thing?
I don't think most of them are. I think most of them are doing it because it's socially acceptable, just like, smoking a cigarette used to be socially acceptable.
Yeah.
But I think that some of them do it because, and they tell me, because I'll ask them, if you do it, like, why? Like, if I have a patient who, sometimes you have to ask the right question because you're looking for a particular answer.
Right.
So for a patient who I have a strong assumption that is smoking marijuana, I won't say, do you smoke, do you vape? I'll say, how often do you smoke and vape? And so at least that way I'm giving you permission to
Hmm.
be honest with me and let me know how often. Well, Dr. Hill, not that often. Well, how often is not that often?
You're strategic with your
Yeah.
questions.
Because if I say, have you ever smoked or vaped? Sometimes they'll pause.
Right.
And I might say, well, have you ever in your lifetime, or the same thing with sex, are you sexually active? And they'll pause and I'll say, have you ever in your lifetime had sex? And then we'll just have a conversation, because it's the way that you answer it, that you
Yeah.
ask it. And in the same way, if you're trying to really find out, what the adolescents are up to, it's a way that you have to answer the question. And sometimes if you ask, how often do you do a thing? It
Hmm.
makes it easier for them to answer that question than to ask them, do you do it? Because then they might say no, because they think that you might be disappointed in them
Right.
when they share the answer.
I love that. I love that. Dr. Naomi Hill is here. We are thank you. Thank you so much for coming on Beyond the Surface. Oh, we have a question. We have another
Okay.
question.
Okay.
From Sharon. She says, my preteen grandson has alopecia. All hair and eyebrows are gone. The dermatologist said it was due to eczema. Oh, there we go. Do you think this will resolve itself and his hair will regrow? He wears a lot of hoodies, so that could do, cause anxiety, depression. What's your professional? Uh,
Oh, okay. So I'm going to speak to this in two ways.
okay.
The first one will be his response to the alopecia could be very depressing, can
Hmm.
be very anxiety provoking. I know this because I have patients who have it, and it can be very anxiety provoking, especially for the ones who have alopecia totalis, where they lose their eyebrows and their eyelashes.
Oh,
It can be very depressing. It can be very isolating. Always wanting to wear a hat and a hoodie,
the hoodies.
not wanting to talk about it. Yeah, so that's the one thing that I will address. I am not a dermatologist, but what I will say about the cause of it is alopecia is a condition where your body's immune system is attacking itself. It's attacking the hair follicles and damaging and destroying the hair follicles. So alopecia is an autoimmune disorder, and if it is a true autoimmune disorder, there will be no regrowth. But I am not a dermatologist, so I'm just going to leave it at that.
You called it alopecia and not alopecia.
Yeah, alopecia.
It's alopecia.
Peach
I
and
just, I
patient,
just,
tomato, tomato.
I know. I
I
just looked
say
at you and
alopecia.
I'm like, the pisha. Oh, that
Alopecia.
makes sense the way you, yeah.
Short E, long E.
Short E, long E. Got you. If anyone has any more questions, we are going to put it in the comments, please. Really quick. We have Dr. Naomi. You have really enlightened and empowered. It has been so much amazing information that you shared regarding like depression, anxiety. Even you went from like the tweens and the manic middle schools,
Middle school
um,
madness,
middle
high
school
school hijacked.
madness, high school hijacked. Yes. You gave so much information to so many parents. It was like, right, Colleen, it was an incredible discussion. I appreciate you being here. Do you wanna wrap it up and give us some tools to go home with?
Yes. Okay, so I know that there was a question about my practice and what insurances we take.
Mm-hmm.
That is out of my lane. Call the office. Advocare Crestwell Pediatrics. Advocare Crestwell Pediatrics. We have an office in Cherry Hill and in Sicklerville.
Mm-hmm.
You can Google me. I am Googleable. And
I know that's right. Google me,
and
boo.
Google me, boo, and find the information, the contact information for my office, and find out what insurances that we do take.
Yes.
My website as a life coach is www.drnaomi.org. You can reach me there and find some information. Thank you about my life coaching.
Yes.
And I can just say that it has just been a wonderful experience. I am very happy to have engaged an audience. My desire is always to inspire and to empower.
I
And
love that.
if I have done that, then I feel like I have been impactful. And as those of you who are parents or grandparents, aunties, don't be afraid to talk to your teenagers. Teenagers are to be seen, they are to be heard, and they are to be respected. They have a voice, and we should honor their voice. We should
Yes.
honor their voice. Too many times we put them on a back burner and we say, you don't belong in this conversation. This is grown folks over here. And just remember that you were once a teen, you were
Yeah.
once a young adult, and just remember how you used to feel and have a little grace. Just because mama and them did this, you from the school Hard Knocks, doesn't mean you have to be the parent of Hard Knocks. We learn and we grow and we evolve. We learn and we grow as
And evolve.
individuals. We can
Yes.
learn and we can grow as parents.
I
And
love that.
just have a little grace and always remember the wavy line in the sand.
Put that in the comments, y'all. Always remember
The
the
wavy
wavy
line
line
in the
in the
sand.
sand. I
And I
love that.
even remember that when it comes to me and my parenting, sometimes I just have to stop and think, is it really that bad? Is it really
Right.
that deep? Do I have to be in control? Because a lot of time as parents, we want to be in control. And when we feel like we're losing control
Yeah.
is when we really are parenting from a place that can be harmful to our children. So we never want to be responsible for our children's anxiety and our
Right.
children's depression. And a lot of time, some
You preaching
post-traumatic
now.
stress, that we have as parents, please don't deflect that onto your children, or project that onto your children.
Yeah.
Learn from that and just parent from a space of grace.
Y'all hear all of this?
Yeah.
So much information and so many tools. I thank you for coming on to just empower and inform. You guys, y'all have to go get Dr. Naomi's book on Amazon. Get there. Get the book, Blended Beyond Expectations. She is an empowerment coach. If you have an event that's happening, email her on her website. You can email her, inbox her, follow her on her social media. You want to give your social media handles?
Yes, so you can definitely DM me on any of my social media handles. On Facebook, I am Naomi Hill.
Mm-hmm.
Just Naomi Hill. I am very active on that Facebook page. So you can even DM me on that Facebook page. But I do have Dr. Naomi L. Hill Hugh on Facebook and Dr. Naomi L. Hill Hugh on Instagram. But I'm happy to chat
Yes,
with you,
follow.
reach
Follow.
out. Yes, actually, yeah, follow.
Follow and like. Yes, please.
And visit my website, www.drnaomi.org. And I'm open. I am available. If you need me, I'm available. Look me
She's
up.
available.
Look
Look
a
her
sister
up.
up.
Yes, please do. Yes, go follow and share. She has some
Yeah.
very insightful information. And I need you guys to get the book, Blended Beyond Expectation, no S. That's how you'll remember it. On Amazon, Blended Beyond Expectation. And it's a workbook, so it's very interactive. So you
Yes.
guys
Yes.
can
Yes.
follow along. I'm sure if you have any questions, she just mentioned if you want to inbox her and
Mhm.
go and reach out to her. She is open. So we have Dr. Y'all, have y'all had a good
Yes.
time? Put some hand claps in the comments. This has been
Yes.
an amazing. I am so blessed. Let me tell you, I really have no idea. Like I understand what's going on, but God has really taken this platform like to some amazing places, and I am always surprised,
Mhm.
but I'm not shocked.
Mhm.
So I thank you for being here. Thank you for enlightening, empowering, informing us. Like this has been very impactful. You have impacted the viewers. You have impacted me. So now that wavy line,
Mhm.
that's where I'm going to live.
Remember that
I'm going
crazy
to
line.
live.
The
I'm
wavy
going to
line.
live in this wavy line. So that way I extend grace.
Mhm.
I extend grace and respect boundaries. You know, even
Yes.
as a grandparent and as a parent of adult children.
Yes.
That wavy
Yes.
line.
Yes. The wavy line, extending grace and respecting
And
boundaries.
respecting boundaries just with grandkids, your adult
Mhm.
children. But yes, all of
Yes.
that. Get in the
Yes.
book
Yes.
because she
Yes.
talks about a lot of that. Go ahead.
And I'm going to go through and look at the comments, and if there was something that I didn't get to, or
Mhm.
I will go through and respond. I will interact with the comments after the fact.
Yeah, so if you guys still have questions, or if you're
Yes.
watching this on a rewatch after it has gone off, Dr. Hill said she will come back and answer your questions. So if you still have questions and you weren't, even you can inbox her and DM her. Like if
Mhm.
you felt like you didn't want to put your question on this platform and you want to ask like a different type of question, I'm sure
Yes.
she's open. Yes,
Yes.
to answering and reaching out. So don't forget to follow, subscribe,
Mhm.
like Beyond the Surface with Sharon. Also follow, like, and subscribe to Dr. Naomi Hill Hugh,
Mhm.
Dr. Hill, and
Mhm.
Naomi L. Hill Hugh. All right. Thank
All
you.
righty.
Thank you. Thank
Thank
you
you
for
for
coming
having me.
on. Thank you for coming on. This has been an amazing show. It goes long, but it's informative. And everyone has said like it has been a very great show with so much good information that was shared. Next week. So next week we have coming on the show. Look, I'm a little bored here. We have it's called, our topic is a leap of faith. A leap of faith in entrepreneurship. We have two amazing guests we have coming on. We have my son in love, that is Andrew Matthews. He will be here, and we have Aaron Hendricks. They are both owners, operators of their own business. So they are going to talk about the leap of faith of leaving their day to day job and going to work for themselves alone, and how their faith helped them get there. So, can you guys tune in next Thursday so we can talk about a leap of faith into entrepreneurship with Andrew and Aaron? So thank you so much again. I mean, I really can't thank you enough. This has been so good. I appreciate you. I love you. Um, a lot of your patients are on here. So a lot of your Facebook people. Um, Once we leave here, Dr. Naomi is going to be available for comments. She's going to reply. So thank you all for watching Beyond the Surface, where I'm here to help you out. I'm giving life, love, and family content. So join us again on next Thursday, 6:30. We are here live on Facebook and YouTube. Check us out. All right. Have a good night, guys.